Hello, my name is Aruthian Oganian. This is video number 4 for Dr. Stump's class, and it is about Internet of Things and VR. What is the Internet of Things? The book definition will be a system of interrelated computer devices, mechanical and digital machines, objects, animals, or people that are provided with unique identifiers and the ability to transfer data over a network without requiring human to human or human to computer interaction via sensors. Now, the Internet of Things are used in technologies such as smart grids, virtual power plants, smart homes, intelligent transportation, and smart cities. A great example of Internet of Things will be this one thing called OpenAPS, which is Open Artificial Pancreas System. It's basically an insulin pump which continuously monitors the glucose levels, and it's actually through an open software system, so it's basically designed for people that have insulin pumps and have the continuous glucose monitors already, which my second example of Internet of Things will be continuous glucose monitoring, which is basically a glucose monitor that monitors your glucose levels at any given time, and it sends alerts through your phone or through the meter itself. And hackers have actually been able to make a combination of both of these items and turning a glucose monitoring system and the insulin pump into one unit. So when the blood glucose level goes up, the pump automatically pumps in insulin, basically creating an artificial pancreas. This is a very great example of Internet of Things. Now we will discuss virtual reality. First, we have to start off by knowing what it is. Virtual reality is a computer-generated simulation of a 3D image or environment that can be interacted with a seemingly real or physical way by a person using special electronic equipment, such as a helmet with a screen inside, gloves fitted with multiple sensors. Great examples of virtual reality in the healthcare field would be the digital standardized patients or virtual standardized patients, depending on which organization is using it. USC has been using it to prepare future physicians, doctors of dealing with patients with different scenarios, and whatever response they give has a different outcome, and it keeps track of interactions and rates the physician or doctor on how well he or she is doing. And another great example of VR in the healthcare field is the some hospitals actually have virtual operations where physicians put on basically a 3D helmet and they have sensors which they perform operations which are delicate, and it's all virtual, so no patient is harmed in the training, and it basically scores on how well the physician does in terms of the operation. This is very helpful for students who are trying to become doctors. We observed three digital standardized patient videos, and what the elements that all three had in common were there was a use of a computer, which was basically how the physician or practitioner was able to communicate with the patient, even though the patient was a computer simulated program. And the second element will be that the physician always used open ended questions. They did not use simple yes or no questions. The reason why this is arguably a good approach to training a physician is because an open-ended question is more difficult to answer and respond to rather than a simple yes or no question. This way, the physician actually has to use their process of thought and see how the patient is going to respond so they know how to respond to that question. In theory, this is a very great approach to physician training. because anyone could answer a simple yes or no question, and they could input the diagnosis, the symptoms into a computer, and they'll find out what the patient has. But when there's open-ended questions, it's more specific.